So we have a final four. Cost cutting at 4, coming out of healthcare economy. Primary care transformation, also a 4, coming out of clinical and business model. And affordability at 2, coming out of purchasers, all up against little cybersecurity trying to truck its way into the championship game. Shahid's comment a minute ago about looking at broad, sweeping, maybe generalized, non-pejoratively, maybe generalized topics like cost cutting and affordability versus tactical things that we really need to get done or maybe on trend. How does that shake out here? Cost cutting versus affordability. You've got big, broad, sweeping trend on big, broad, sweeping trend. How do you even decide who emerges there versus primary care transformation or cybersecurity, where you've got, Danny referenced it earlier, where you've got regular ongoing breaches of PHI, oftentimes either based on a lack of IT or infrastructure modernization that's happening, that's impacting a pretty significant amount of the way we think about healthcare, where primary care equally or primary care transformation equally impacts a significant amount of the way we think about healthcare, where we don't have enough primary care physicians to be able to deliver the type of care that we need and want. So big topics, all 4 of these. Now, how do we figure out what amongst these 4 deserves to be in the championship game is the task in front of us. Let's take each one, cost cutting versus affordability. Observations in your mind, just about the fact that those 2 are in the final 4. Anisha, what do you think?
I was actually going to make a general comment where I think if I think about the last 4 that are remaining, you're right, they're all at different levels. I wonder if we thought about it in terms of how many resources each one will consume within the healthcare ecosystem more broadly, right? So if you think about cyber, clearly it's very focused on the technical and clearly at cost as well if there's cybersecurity breaches. Whereas your point on primary care transformation, there might be more resources, mind share focused around it. And so I would think of them in that way, which is if we think about the priorities within each of our organizations that are very diverse, which one of these 4 really kind of sings as being top priority in 2023?
And maybe build on that. So you're saying sort of level of effort and maybe against impact, right? And so if we kind of looked at that and kind of, did a 2 by 2 on that to say, what is level of effort and impact against each of these categories, and what could be the result?
I just go number of headlines, because again, I think all of these, but you could have a tremendous amount of effort on the PCP transformation, but unless there's like a large transaction or a large partnership, what's the headline going to be in PCP transformation this year? I don't know. There might be something, but the CVS's partnership with, Walgreens and Village and Summit and CVS and the Iora. I mean, those have occurred. So with PCP, and again, I'm just picking on them a little bit right now, but what's the headline that's really going to jump out relative to that this year? Versus, again, cost cutting, it might not be resource intensive because people are just making decisions and moving, but I could see Q1, Q2 of this year being, restructuring, reorging, cutting services, all of those things that, we saw in Q4 just continuing to kind of persist into this year. Could be a snowball effect is the 2/3. Is there a realization and kind of a risk benefit analysis that's done for provider organizations, health systems, where they get to the point where they say the investment that we make on our primary care physicians is no longer affordable. Mm-hmm. And so I'm going to contribute my primary care physicians into a Walmart, a someone to get the losses off the books, but then somehow creatively via a risk-bearing entity continue to keep the relationship in place but you allow these organizations that really understand and know how to run PCP models, let them do it. That's what they're good at. We're good at taking care of really acute patient needs inside, bricks and mortar. And if that realization does occur in 2023, there could be a significant storyline with multiple health systems, going down that road. I don't know if we're at that tipping point yet, but that's an avalanche that
But
I
I think,
could
Danny, we
potentially
may be closer to that than we think if we don't. So when I say transform the primary care model, that's a big reason why. So when we say 60% are employed, that doesn't mean by health systems. I mean, everybody who's with Village, MD, Oak, all that stuff, they're employed, right? So
I was just talking about health systems.
Yeah,
But still about 60%.
yeah, but so is a lot of them are shifting away from us.
Oh,
And what I'm
sure.
concerned about is we're losing a lot of our PCPs to these other companies because they are paying them on value-based care. They can give them better benefits. They can practice medicine and spend time with the patient. And if we don't start competing with that on the health system side to keep our PCPs, which drives all of our specialists, drives our revenue in every area, we're going to be in trouble, because I think then you're talking about, now do you have, just like revenue cycle, for years we all did it ourselves. Okay, now it's being outsourced to everybody. Are we going to be outsourcing our whole PCP model? And that's a scary thought. It may be the right thing to do, but I don't think we're quite there yet. But if we don't look at transforming this model in a big way to keep them where they want to work with us versus the private equity world, then we may have a tough decision.
So we'll vote on
That's
this
a great
one.
point, yeah.
I don't think there is a big headline. I think it's a move that, I've been in favor of, because at the end of the day, I think primary care needs to play the role that primary care is configured to play, which is longitudinal relationship with people to keep them healthy.
Yep.
And I think that the model, the economic model to support that has to align with you win when patients don't need downstream care. That model is all around affordability at the end of the day. And I think the headline, and this is an unfair battle, because I think affordability should not have been a team in this competition. It's an abstract idea that it's easy to fit a lot of activities under, or a lot of thinking under. But at the end of the day, 56% of Americans can't afford $1,000 medical bill, period. Full stop. That's it. We've outpriced healthcare in the United States for the average consumer. Most everything we've talked about in some way or form is being driven by a need for affordable access to care. You got a lot of third parties like insurance companies and PBMs are going to get raked over the coal because they're not adding as much value as they're probably extracting. You've got this whole move to value, which is really driving the primary care transformation, is an affordability one. So to me, it's almost unfair, because I don't see how you can have anybody win this tournament at this point other than affordability, because it's just so massively galvanizing around most of the ills that kind of afflict the U.S. healthcare system. I don't think most Americans are waking up this year more worried about cybersecurity or their information being stolen. I think they assume it, at least in the last year, 3 times, I know my information was accessed in a large scale, like, breach somewhere. I just assume that's going to happen every year at this point. The system that it happens to, it's a disruptive thing, but I think at the end of the day, that's not going to even get the headlines that healthcare being unaffordable.
You don't see anything about primary care transformation in the news. And it's just an interesting comment, because if we think about how much mind share we spent talking about that, and how many resources, everybody's dedicating towards that, and how much money has gone after it, yet as an average consumer, you're like, isn't that what primary care is supposed to do? It's sort of table stakes. And so it's interesting that internally within the industry, we spent so much time and so much money getting to what the buying public assumes that we already do, or already do well.
And we still have so far to go,
Right.
to get to the point where
So-
the environment actually thinks that we're operating that way today. And I go back to, it is kind of unfair that that's the topic. That's the common thread. But I think over and over and over again, we're going to hear stories around elimination of services. I mean, labor and delivery, inpatient services, all of that kind of stuff. So we're going to hear that. We're going to hear about, org redesigns, and that's going to be the biggest story, I think, in healthcare, at least through Q2 of this year. And because of that, I've got cost cutting going into the finals, and actually beating affordability, even though affordability is the reason for the cost cut.
And that's a great point, Danny. You can't get to affordability if you don't cost cut. I don't
if the
think
cost cutting is wrong.
correct. I mean, and you're right. Everything in the headlines, every not-for-profit, every for-profit has done a RIF of some sort, whether it's reorganization, layoffs, et cetera, and just away from the health systems, as you said earlier, Anisha, all the PE firms, all these overvalued companies are doing layoffs left and right, and then the big people, Walmart, Amazon, et cetera, all doing layoffs. So I agree with you 100%.
So, well, hang on, I want to just make sure I heard you right. Like, I'm not sure closing service lines or laying off healthcare workers leads to affordability. If you define affordability as what the consumer or purchaser of healthcare services pays for services, I think it may actually go the other way. If you can't get access to a healthcare service in your rural market because your hospital closed, now you've got to go 60 miles away to the city, your price for care may go up. So I don't necessarily understand that you can't have affordability without cost cutting.
Yeah, and how I was piecing those two together, Dr. Carmouche, is hospitals or health systems that are eliminating services can't afford to offer those services under the current reimbursement model. And the halo effect is, if they were given the rates necessary to offer services, then it would also be unaffordable to the patients seeking care at that facility. So it's kind of a webbed affordability definition.
Have we heard enough to vote? Cost cutting versus affordability. Cost cutting is the black, affordability is the red. Black, 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 red, 4-1. 4-1 cost cutting. Primary care transformation, a 4 seed versus our only remaining Cinderella, or our only Cinderella, cybersecurity, 6. Primary care is black, cybersecurity is red. Black, black, 3 blacks, 1 red. Danny stands alone. Primary care transformation takes it. Okay, 2 4-1 votes and 2 4 seeds.